Hi, I'm Lisa Marie South, independent registered midwife in the UK. I am going to talk to you today about what is normal with a newborn. Often a newborn baby will have a cone-shaped head, which is totally normal. It's just where the fontanelles have crossed over each other as baby comes through the pelvis. The other thing that's quite common is that they have something called caput, which is basically small areas of swelling, possibly a little bit of bruising on their head, just from where they've had pressure against the pelvic bones as they've passed through. This may also be more obvious if a baby has had a forceps or a ventouse birth because of the direct pressure of the instruments. All of these are quite normal. You may see two little soft spots on a baby's head. So the first one is right at the back of their head. This is the occiput, and then you've got one that just sits at the front of the head where the two bones of the skull have crossed over. These are again soft but normal. They shouldn't be sunken. That is a sign of possible dehydration. Some parents choose not to wash all the birth fluids off of their baby. This is an important part of the bonding process and initiation of breastfeeding in terms of hormones. So please do respect that. It's quite normal for babies to have hair or to not have hair on their head, and it's quite common for that hair to change colour as well within the first few months to a year of life. Along with all the birth fluids that you might see on a baby, you might see some really thick white creamy stuff, and this is called vernix. So this is the waterproof coating that a baby has whilst they are in utero. This is really great stuff. It's super moisturising for baby's skin, so definitely don't wash that off at all. A baby's genitals can look quite inflamed and swollen after birth. This is normal. This is part of the hormonal process, the amount of hormones that have been involved in the birth process passing through to the baby. So little boys will have quite swollen and sometimes blue looking testicles, and little girls will have quite swollen labia. Both sexes of baby will generally have quite swollen breast areas. This is normal. Little girls sometimes may have a small amount of milk oozing from their breasts, normally within the first week or two of life. Again, this is completely normal, mild lactation process for babies. You may also notice with little girls that they have a mini menstruation period. This normally happens within the first few days, can look a little bit mucousy and pinky. Again, this is quite normal. Sometimes babies will have a spot of what is called urates in their nappies. This should only be present once, maybe twice in the first 2 or 3 days. It can be a normal process, but if it is persistent, then it could be something to be concerned about. You'll probably find that as babies are born, their skin looks quite different. So some babies have newborn spots. Normally within the first couple of weeks they disappear. Some have more intense spots that are like a newborn acne. Most babies have a small amount of soft downy hair on their skin, and you can also find that babies have birthmarks. So some might have some darker pigmented bluey looking birthmarks, normally over their sacrum area, top of their buttocks. These are called hyperpigmented macules, and they're quite normal. They should be documented by a healthcare professional when they've noted them and seen them. Some babies have port wine stains, so darker, redder kind of coloured stains on their skin. This is a normal birthmark. and some babies will have pressure marks from where they have been through the pelvis, so often kind of on the forehead and over the eyes. Again, all of these are completely normal. Other things to watch out for that again you'll find are quite normal are little tiny white spots across the baby's nose and the top of their cheek line here. This is called milia, and this is quite normal. If you see any rashes or anything on the baby that you are concerned about, then do talk to the parents absolutely about that straight away. Newborns are relatively susceptible to getting heat rashes, so these just look like little red blotches of skin across their body, sometimes a little bit pimply. Normally if you just pop the baby somewhere cooler, that can help, but this is normally associated with lots of skin to skin time with mum, which is really important for the baby for bonding and for regulation of their temperature and breathing. Babies' umbilical cords normally take about 3 to 10 days to fall off. As they start to dry, they'll go nice and dry and a little bit crispy. Kind of think of it as like a scab falling off. So the first process is that it starts to go a little bit sticky on the outside, maybe a little bit smelly, and then as that comes away, it might just fall off in the nappy. You might feel like you're catching it, but actually that's totally normal, and there's no nerve endings in there, so the baby doesn't feel the process of the cord coming off. If you want to care for the cord, the very best thing to do is to just leave it alone and to not allow it to get wet. If it does get wet, then making sure that you pat it dry and then air dry it is most important. Every time you change a nappy, if you just fold the nappy down, allowing the cord to just sit out the top of it, this will help keep it free of any moisture from urine and will also allow the air to circulate around it as well, keeping it infection free. If you're concerned about an infection in the cord, please speak to the parents straight away. The common signs of infection in the cord include some inflammation and redness, particularly directly around the umbilical cord on the skin. Often you see quite a dominant red ring around it as well, and it can smell quite offensive, very different to the slight sticky smell as it's separating. You will notice quite a strong offensive smell. Jaundice in the newborn baby is a normal physiological process which is particularly present when babies have been breastfeeding or have had optimal cord clamping at birth. What you tend to see is a slight yellowing of the skin across the face, around the body. Sometimes this first presents as quite a redness in the skin, and then you can see a yellow tinge underneath. Occasionally you'll see in the sclera of their eyes, the white bit of their eyes will have gone yellow as well. Jaundice is something that is completely normal, completely physiological if it's present after the first 24 hours of birth and has cleared within the first 2 weeks of birth. The best thing to do is to make sure that the baby is feeding frequently, is passing urine and passing stools, and those stools are changing colour as well. There is some merit for keeping baby in daylight, although it's not absolutely essential. So as long as they have access to daylight, but they don't need to constantly be kept in a daylight setting. The most important thing is that the baby is feeding well, is passing urine and is passing stools, and that the baby is generally well. If you have any concerns with jaundice at all, then please speak to the parents straight away, and they can contact their midwife and they can get some additional support. A well newborn baby is a baby that is feeding frequently, is passing urine and is passing stools. When they're awake, they are nice and alert, and they sleep many hours, and when they wake up they're looking for food. A baby that is unwell is one that is very lethargic and sleeps a lot, doesn't rouse easily for food, or has become floppy. That is when you would want to seek urgent help if a baby has become floppy. If a baby is generally lethargic, then I would advise immediate medical attention, contacting a midwife or healthcare professional straight away to discuss this. Ensure that the baby is feeding frequently, is passing urine, and is passing stools as well, and that those stools are changing colour from brown to greeny colour to yellow. Should be yellow by around about day 5. If you have any instinctive worries or concerns about a baby, please speak to the parents straight away or access emergency medical help if you are concerned about a baby's breathing or their colour. If they have gone blue around the lips or are limp and floppy, please seek emergency medical help.